Hello and welcome to Voice TV Nigeria. I am Magdalene Palmer as usual. Today I'm going to be bringing you a very interesting episode of my program as usual, and I have a very entertaining guest today with me. He's going to introduce himself shortly, but first I want you lovely subscribers to keep subscribing to Voice TV Nigeria on YouTube. Stay tuned.
I can tell you that in the last 100 years, no new antibiotics have been discovered.
Good evening, sir. May I get to know you and what you do?
I am Dr. Ben Amadu. I'm a fellow of the Pharmaceutical Society of Nigeria. I'm a fellow of Complementary and Alternative Medicine, recognized by Nigeria Medical Association. I am a lead phytomedicine researcher under Halamin Herbal Products. I have been in this research in the last 30 years, and my field of research are in the areas of communicable and non-communicable diseases. Communicable diseases are diseases we get through lifestyle. When we meet women, we don't know them very well, we decide to go out with them. By doing that, we contact HIV/AIDS, hepatitis A, B, C, D, E, tuberculosis, Ebola, Zika, Lassa, bubonic, Toyota, Corona, and even Mercedes. Many more viruses to come. They could come with different names. But the good thing is that with our research, we are specifically into the viruses. And our discoveries are beyond human imagination. As for the non-communicable disease, which is another gamut of diseases troubling the entire world, why do I say so? Non-communicable diseases are diseases we age into as we journey on this earth. According to WHO, in 2008, non-communicable disease was responsible for the death of 36 million out of the 57 million reported worldwide. There are diseases like high BP, high triglyceride, high cholesterol, cancer, stroke, diabetes, chronic kidney diseases, asthma, arthritis, ulcer. These are the gamut of diseases referred to as non-communicable diseases. And if you take the percentage, 36% over 57 multiplied by 100, you are getting 64%. And that 64% is the singular cause of death in the entire world. And with the coming of Corona now, we are already edging to, is it 20 million for the whole world? One disease under non-communicable. So there's a lot of things to be done.
Now, what I'm trying to say, the controversial issues are coming from like the medicine that was made in Madagascar on saying that they have to take it to be taken to the clinic to be proven that this is a cure for COVID-19, and then now you're coming out with your own product saying that it's so effective. No. Now I want you to compare.
No, Madagascar, we have gone beyond. Okay. Madagascar came up in Madagascar and ended in Madagascar. Okay. Sabma came up here in Nigeria, went to Ethiopia in the UN, went to US first for publication. Publication leaked it to WHO that Nigeria has done a good job and discovered the cure for malaria. WHO sponsored us to the United Nations to present that report about 10 years ago, which was accepted. So Madagascar has not started any journey, and we have been peer-reviewed and published in the Indian Journal of Medical Research. Let me know which journal published Madagascar. Which journal? There's no journal that published Madagascar. And in any case, the NIPRID, which is the Nigerian Institute of Pharmaceutical Research, which is a WHO Center of Excellence here, located in Abuja here, has worked on the so-called COVID, the Madagascar COVID, and found out that it only has cough reducing effect, which my DAPS has a cough reducing effect. And after this program, I will show you where a COVID patient who had cough used my product for 3 days and said the cough has almost gone. So that will beat Madagascar hands down. So not talk of this one that is a total cure. It's not doing an aspect of COVID. It's doing COVID in totality. What the world knows is vaccine. You have to take an organism, kill it, suspend it in a chemical, and use that chemical to give somebody an injection on the shoulder, thigh, or somewhere. That is the idea of vaccine. A vaccine can come in a natural form, just like my Sabmal and my Savid-19. And when I introduced Savid-19, I said, it is a cure for cancer of the throat and other throat diseases. When COVID enters the nose, enters the mouth, it comes to the throat. At the throat level here, it is blocked by my Savid-19. That is standing on its own. My 3 combination of Sabmal, and Sulfur-6 also have the capacity to start the blocking there. And if anyone penetrates and enters the lungs so as to cause fibrosis and lung diseases, the Sulfur-6 would take care of that, because it has been proven in the University of Texas to have the capacity to stop cancer of the lungs, fibrosis, and pneumonia. That is why they are in a combo. And the SAB has been proved before now. That's the one I call Chief of Staff. It has responsibility for the human system all over. What does it do? It boosts the immune system beyond human imagination. Then the Sabmal, of course, it has, and these products, all of them, they have antibiotic effect, they have antiviral effect, they have temperature reducing effect.
So it's not a product that you take and then go and affect maybe the liver, or maybe you're trying to...
No. They have immune boosting properties, so that by the time, in a combo-like manner, like my SAB contains vitamin D, which is very difficult, except you expose yourself to the sun, and before you know, you have cancer, you develop cancer. It has vitamin D, which we made through atmospheric water, is there. So, vitamin C, my Sabvid, it has over, the percentage of vitamin C is over 90%. And you know, when vitamin C is concentrated, it becomes an antibiotics. So, all the ingredients required for the treatment of COVID, naturally, is inside my product. And that is why I propose a combo product. And one of the other products that is going in now for registration with NAFDAC, it has the capacity to dissolve embolism. From report we had from Italy, we had that once you have COVID, you start having clots and all that. With that product included, all that will dissolve away.
Okay, sorry to cut you off. What is the difference between chloroquine and your own drugs? Because some of the doctors in the USA talk about chloroquine and other medicine. What is the difference between chloroquine and your own product?
In that report that was done using Beggy for an experiment, Sabmal was tested against chloroquine and pyrimethamine in terms of its prophylactic effect, its prophylactic effect, its curative effect, and its suppressive effect. At the end of the day, it was found, its activities were found to be equal to that of chloroquine, and at best, more than that of chloroquine and pyrimethamine. So this shows clearly that Sabmal is higher than chloroquine and pyrimethamine. And in use today, we have found COVID patients reporting to us that within 5 days, some within 10 days, got their COVID resolved without any singular side effects. The issue of kidney, whatever, which some people may want to line with to give herbal medicine a bad name, it is not true. We reverse kidney diseases. We reverse liver diseases. We reverse heart diseases. And for this reason, the text messages we got from our patients, we are going to download some of them on the YouTube to show that rather than our product cause kidney, liver, heart diseases, they reverse them. And I'll give you an example. In the medical parlance, once a patient that is hypertensive for a long time, is careless or is not administering his or her drug well, he would develop an enlarged heart. If he treks from here to a short distance, he becomes tired, palpitation. If he's going to climb a first floor, he will find it very, very difficult to climb it because of the enlarged heart. In the medical parlance, what do? They will tell you that you have come to the end of the road, because to do an open heart surgery is a highly technical, specialized, not a small child's play. So, and the cost is too much.
My own personal question now is that we've heard of these viruses, new viruses, other viruses that are supposed to come up in the near future. Now, is your product going to be a cure to all these kind of
fantastic question? Fantastic. I've heard of bubonic. It has killed some people in China. It is the same principle, as I told you. The basic test that we did was for CD8, and this CD8 gets increased. For Ebola, our product is effective. For Zika, it's effective. So for bubonic, it's a done deal. So let Toyota come, let Mercedes come, G4, whatever, let them come. We are ready. If you are talking of issues relating to cardiac diseases and arrest, we already have cardiac glycoside there. So, flavonoids, those ones antioxidants, they boost the immune system beyond human imagination. So, any way you look at it, the COVID-19 is well built as a natural vaccine, having contained all this. And we're not stopping there. When they did the test to see, they found out that the organism it has significant effect on is Streptococcus pyogenes. Streptococcus pyogenes is the causative agent of throat and throat diseases, which means my former assertion that my product is a cure of cancer of the throat has been proved beyond reasonable doubt. And that is what science is talking about. If they are the ones, they will talk. If this had happened in Europe, they will talk from their head down to their leg. So why will I not shout out in my intellectual property of what I have been able to achieve on behalf of Nigeria State? Why should I not? And I'm not going to keep quiet until all the results that are coming are well utilized. The world needs to know this. We need to help the world. And we need to show that the new world order is that those our gardens, those our forests, the things that are in them, will beat the best laboratory in the US that we see in films. The best laboratory. What they do there, we enter the forest, we neutralize them. So, with this result coming out of Rome, we already have in our hands a potential oral vaccine that, when compared to the synthetic, chemicalized, chip-based vaccines, either for monitoring people, for all kinds of whatever agendas that are there, we have a natural one, devoid of any side effects, unlike the chemical ones. It's cheaper to make, and the world is even made poorer by the invasion of this corona. No businesses are going out. Everything has come to a stop. And using WHO guideline, while WHO preferred herbal medicine, WHO has gone to all the continents of the world and found out that over 80% of the world population depended on their folklore medicines. And that's why WHO say go and test them. Are they stable? Do they have side effects toxicologically? If they are not, then WHO is not even talking of effectiveness. But for my products, I talk about the effectiveness. I do the efficacy test first. That is why I did not rush to register my SABVIT. I took my step to first of all get the efficacy test, which with the result coming from VOM, to say that it has a significant effect on the Streptococcus pyogen. We are good to go. We are good to go. We are good to go. And Nigeria is on top. And it will compare with any vaccine anywhere in the world in terms of any properties. An issue of the vaccine having any side effect, no. Rather, it will clear and detoxify the human system and drive away corona to where it's coming from. Back to Wuhan.
Yes, that would be very interesting. Finally, you've talked about staphylococcus, anemia, everything. I want to know, do you have any drugs on sickle cell?
Yes, before that sickle cell, we dwell very well on communicable diseases. We did not say much about non-communicable diseases, which is the one devastating the entire world. So I want to quickly run through. In our research work, we have good results for diabetics. For the first time, with lifestyle modification, within 6 months, we get diabetic to normal levels, and thereafter fluctuates within normal level, but the individuals will have to take a lot of vegetables, a lot of fruits, do some level of exercise, limited exercise, take balanced diet, and then refuse to allow their weight to increase, and stop sweet things, Coke, Coca-Cola, sweet drinks, reduce salt intake, and then red meat. I abstain from red meat because it's the chief cause of cancers. That is for diabetics. And for the first time in the world, an unhealed ulcer of the leg. This is for the entire world because it's a big problem. As I speak to you, about 10 to 30 people are amputated every week in the United Kingdom because of an unhealed ulcer of the leg. This is a big one. Solution to the entire world. Nigeria has now a solution from the treatment of diabetics with those who have an unhealed ulcer of the leg, which can be cured without the need for amputation. How do you think, how happy will a patient feel if he's on admission for his amputation and they said they have gotten a product, you are no longer going to be amputated? So this is a big message the TV station is conveying to the entire world, so that a lot of people who are in need can be saved. Then we go to that is diabetics, high blood pressure. I have told you about the complication with respect to the heart, which our drugs brings to normal without operation. Then we now go to cancer with the report from US, Texas. We have been able to manage prostates, breast cancer, cancer of the brain, and we have worked on our hem to deal with to deal with cancers of the breast. And as time goes on, we will take permission from government to see how we can work better with government to, instead of the multi-billion this thing that we are destroying, to see how government can convert that as other countries have done in the world. Then we go to chronic kidney disease. We have herbs now that can reverse chronic kidney disease to the glory of God. The issues there are issues of creatinine level, issues of urea, issues of shortage of blood, consistent shortage of blood. Patients go into dialysis with blood shorting and they come out perspirating as if they want to die. But when they are on this product, with time it regenerates the various tissues that are diseased in the kidney. It regenerates them back, just like the same thing it does with the isolate of Lingerham in the beta cells for the diabetic patients. It does the same for the kidneys cells. So at the end of the day, with time, those patients no longer undergo dialysis. They go into dialysis. When they're on our product, they come out with their PCV, their blood level remaining normal, and they don't do like this as if they want to die and all that. So that is for the kidney. So anybody who tells you when they take these things it will affect their no, our own, it will rather repair the kidney. Then liver, similarly, because we are masters of hepatitis A, B, C, D, E, and you know hepatitis centers on the liver, fatty liver, all those issues are within our domain of our research. Then we talked about ulcer. A 54-year-old man came here, had ulcer for 54 years. We cured him. My wife did pepper soup. We made sure he would take it. He took it like this. He will be looking at it. He took it like this. He brought it like this. He hanged it here. He did like this. He ate it. And that was the beginning of his eating pepper from that day. Ulcer gone and cured. America budgets over $8 million or $8 billion for the treatment of ulcer every year. And then asthma, I've earlier told you. So, coming to sickle cell, finally, to the glory of God, our research of over 30 years has come up with a cure for sickle cell. And while we were doing this research, NTA was supportive of us. There was a small girl we were treating. We were giving the drug free, and NTA went to monitor the girl, the mother, in their home, and was monitoring to see that it is not just a fake news. And at the end of the day, the girl was interviewed. How do you like this product? She said she likes the product. Mother, how do you feel? Yes, the hospital visit is not as frequent as before. The girl has started improving. And when they were finishing, the girl said, I would like to continue to use the medication. And to the glory of God, this was about 10 years ago, we now have a proper cure. When we give you the medication, the first 1 month, you will see that gradually the PCV increasing. And when it reaches a particular level, that is within the first 1 month, all the attacks, mommy, leg is paining me, mommy, stomach, mommy, hand, that makes a man and his wife to wake up 12 midnight, 1 a.m., 2 a.m., and rush to the hospital, where poor physicians are confused. They give palliative and they discharge them. A week again. But while they are on this for 1 month, they get stabilized. The remaining 4 months, they take their drugs. Go and do your test. After the test, SS, now AS. End of the story. Nigeria has, and finally, we beg government partnership so that the projected $5 trillion herbal business projected by WHO from this year, Nigeria can obtain substantial amount through the work I'm doing, through the work my colleagues are doing, so that the country can rebuild itself and diversify. Nobody talks about the herbal subsector, which has this potential in view of what you have heard from my mouth. Those who are going for heart operation, they go to India, they go to whatever. There is one which you people will download from today. I treated the former governor. He has heart failure, liver failure, kidney failure. He has been to 4 to 5 hospitals. No solution. The heart is enlarged, prostate is enlarged, kidney is enlarged. He went to 4 hospitals. The download is here, which I will give to you. I don't lie. I belong to 2 noble professions. I'm a pharmacist. I'm also a lawyer. And I'm chartered. So he was to be taken to India. The report they sent to India, they said he has to remove his heart, remove his lungs, new ones put, just for him to be transported there. But to the glory of God, a patient went to visit him, just a visitor. He said, if you are not getting better, why are you still here? Go and check Benamodu. His drugs are very good. I never saw the patient. The history by the wife was enough. and we dispensed the medication. To the glory of God, he had massive stroke, sitting down like this. He can't get up, he can't walk. Within 3 days of the use of my medication, he got up and walked. And the wife said the BP normalized, the sugar normalized between 5 and 6, and the heart has started working better than before he became sick. So with this, is Nigeria not on top of the world? Where else can you get this type of testimony? So we are willing to partner with the federal government under the President Commander-in-Chief, General Muhammad Buhari, under whom I served in Jordan Barracks, working with his chief physician, Professor Sadiq Wali, and they created this environment for me to be able to do this research. And it has come to the highest level now. So we need to take Nigeria to the next level.
Thank you very much.
Thank you.
So his own question is, what are your drugs made of? Are they made of chemical? Are they made of chemical materials? Or what makes it different? What are those other chemical drugs? What makes it different from your own drug?
Yes, you call it chemical. From the beginning, drugs came from plant. And I'll give you a few examples. Aspirin comes from the back of a meadow plant. That is where aspirin is harvested from. Cocaine, no, not cocaine, let's take simple ones. Morphine and petidine come from a small poppy plant grown by the side of a hill in Pakistan. And I can also tell you that Perinku, from which vincristine, vinblastine, these are well-known anti-neoplastics, anti-cancer drugs. They come from Perinku. And Perinku is a small kind of plant that grows in different locations. And as I speak with you, quinine, chloroquine and co, is it not from Chincona, the back of Chincona plant? And I can tell you that about 74% of drugs that come from plant, they correlate directly with their folklore uses. What I mean, if the back of aspirin, miado plant was used as an aspirin, in the olden days, they were using it to treat pain. So that is correlation. Now it is made into aspirin. It correlates directly with the use to which they were subjected. So if 74% in any exam is a very big pass mark, it is in an attempt to mass produce. That is why scientists went into the lab to study the structures in pharmaceutical chemistry, the structures of these medicines, so that they can mass produce them. But in an attempt to mass produce them, there are small mistakes made here and there. And those small mistakes are what we are seeing today as side effects. Yes. I can tell you that in the last 100 years, no new antibiotics have been discovered. In the Great Britain, one of the prime ministers got annoyed and decided to find out what are the causes of treatment failures in the United Kingdom. And he set up a research team headed by O'Neill, a well-known researcher in the UK. And their fear was that with time, hip replacement operation is going to become difficult, cancer treatment, because of the way of resistance of existing antibiotics. And what did he submit? He said, yes, the fears are correct, that Salmonella, E. coli, Staphylococcus, he referred to them as the 3 megabugs, have devastated the UK medical system, and that no antibiotics cure them. But to the glory of God, American scientists came to my lab here, took 5 of my anti-cancer products to the state of Texas. What happened there? The first to be tested is called SAPFA6. You can Google the name, SAPFA6, on the internet. Google the name. It was analyzed for the cancer of the colon. As they were doing the test, they see that it has up to 89% cure rate in that cancer. And they saw some elements to show that it can be used for the cancer of the lungs. So they set the experiment pari passu at the same time, and they got 89% in both. And today, to the glory of God, we now cure asthma from that discovery. Asthma now has a cure in Nigeria. Is it a child's play to cure asthma? Asthma that you have to give aminophylline injection, you have to give inhaler, you have to give all kinds of nebulizers when somebody has an attack, can now be cured by a food preparation. Is it not a huge information for the entire world? Some people are having asthma, they are being devastated, they are looking for cure, and here we have the cure in Nigeria. We can diversify our economy with the use of this type of funds. You know, today, the discovery in the US was presented to a gathering of over 18,000 American scientists, where my discovery was termed a lead discovery. What else? The federal government, about 5 years ago, Cuba invited us about the non-use of chemical in the treatment of cancer. And the Federal Minister of Health wrote me to say that we know that you are researching into this area. Come and represent us at Cuba. I sponsored 2 of my staff, scientists, to go to Cuba with samples of my drug. I didn't go. And what was Cuba inviting us for? They have discovered a cure for cancer from the sting of a scorpion. I'm sure the sting of a scorpion, they took it through all kinds of chemical analysis to arrive at the cure. Whereas I am just dealing with food material that has no side effect, that has no complication with anything. So if the 2 are presented, which one would you accept to use? So I can give you all kinds of analytical. This same Sulfur 6 was tested to have serious effectiveness on the three megabugs of Salmonella, Staphylococcus, and E. coli, which is a major problem in the world. UK is looking for a solution. US is working on an old antibiotics to see how they can convert it to do this work. And yet Nigeria is already ahead of the world. So all we need is collaboration. Let government partner with us so that we can enlarge this. And we have tourists coming here, staying in Nikon. Because of these effects of these 3 megabugs, today, we cure kidney stone, which you know, you'll be operated like this, a human being cut into 2, and the stone removed from the back. This place refuses to heal because of this. They can do other processes, but the simplicity is that you take our combinations with plenty water and you piece out the stone. No form of needle, no form of knife. Second, as a result of that, we now cure fibroid, which 3 ladies can sit together. 2 must have issues about fibroid all over the world. The white ladies, some of them, when they are in pain of fibroid, they are crying because they don't want injection. And those are the things we have. You just swallow our combination, the fibroid pain disappears. As a matter of fact, if somebody does not tell you your next menses, you will not be ready. You will just see it at the back and say, mommy, look at some stain. Then you go and change your part. We have done that. And as an implication, we also now take care of fallopian tube blockade, which will undergo operation, but this time, no more operation. You take this product, it goes in there, open the fallopian tube, you can now conceive. Watery sperm by a number of married men have watery sperm, quick ejaculation. All those we now cure with a simple procedure without. Even people that have IVF and have failed IVF, we bring them back online. Because IVF tries to undercut this massive infection to see how they can bring pregnancy. Because if you don't take care of this infection and you go forward, the lady may not be able to be pregnant. And when he gets pregnant, he will abort it because of this thing. And finally, on the comparative advantage of this research of ours, I have mentioned to you fibroid, fallopian tube, the cure for ulcer, which has no cure anywhere, asthma, I have told you, and what else? Prostate cancer. If you have prostate, what they do is for doctors to yank you here, urologists yank you here. That's surgery, chemotherapy, radiotherapy. But because of what we have done, there would be no need for surgery, chemotherapy, and radiotherapy, the first of its kind anywhere in the world.
So we are getting to that world that there won't be surgical.
No surgical